the outpatients and they'll say, sir, we are having off and on bleeding from the nose. So it can be either unilateral, it can be bilateral, right? Either from one side or from both the sides. So, and there will be some group of patients, one group of patients who will just come to you and say, sir, frank bleeding to hoy na, kintu there are streaks of blood in the nasal mucus. We will call it epistaxis. So no. Okay, active bleeding from the nose is called epistaxis. Okay. So when you are seeing a patient of epistaxis who has come to you with epistaxis, so what are the important history points that you should take? Start. Someone volunteer. First, always start with patient demographics. That is very, very important. Patient demographics means age, sex, very important. Why? Because there are many causes of epistaxis that belongs to a specific age group or to a specific population. So it is important. Okay? For ENT particularly, I am not talking of any other subject, I am not aware, but ENT ক্ষেত্রে always when you are asked about the history, start with demographics. Okay. So first you will see the age of the patient. Firstly, you will listen to the complaints. So the patient can either tell you, sir, আমার একটা side of nose দিয়ে recurrently bleeding হচ্ছে. First scenario. Second scenario হচ্ছে, স্যার দুদিক থেকেই ব্লিডিং হয় অথবা কোন দিক থেকে হয় বুঝতে পারি না, ব্লিডিং হয় এবং রিকারেন্টলি হয়. Third scenario, like I told you, there is no active bleeding as such, but the patient experiences blood streaks in the mucus that she or he coughs out. নাক ছাড়লে যে মিউকাসটা আসে তার সঙ্গে রক্তের ছিটে আসছে. Okay, and the fourth and common, very, very common scenario is active bleeding epistaxis. The patient has come to you with an active bleeding. Okay, so how would you manage? So first day, what you will see, আমরা যে কোনো case, whenever we are managing a case or whenever looking at a particular case, so we notice a few things. Obviously, we start with history. We'll ask the patient or the relatives, how did it start? So we already know the age, sex, and the patient has come to you, know the age, sex, right? So we'll start with history. One is onset. So, for example, like he said, history of trauma. A history of trauma will have an acute onset epistaxis. Okay. So the patient will say, yeah, okay, I had a trauma at this point of time and now I am having epistaxis, or I had epistaxis and now it has stopped. Any one of this. So you get a definite lead. It has started from somewhere and you know the diagnosis. There is nothing more to do from the diagnostic part. But if the epistaxis is anything related to, or it is related to anything other than trauma, then comes the question of detailed history taking. Right? Patient এসে তোকে বললো যে স্যার আমার এক নাক থেকে বা দু নাক থেকে রেকারেন্টলি ব্লিডিং হচ্ছে. ঠিক আছে, তো we normally what we do is আমরা দেখি what is the age group. ঠিক আছে, if you are talking of kids, either they can be kids or middle-aged individuals or elderly individuals, right? এবার our differential diagnosis varies according to the age group. A 5-6-year-old kid has come to you with epistaxis. Your DD will not include hypertension. Very unlikely. Or a 70-year-old man has come to you. Your DD will not involve juvenile angiofibroma. Understand? So that is why for epistaxis age is important and also sex is important. Okay? So প্রথমে আমরা will divide, in our mind we divide the patient into different age groups. We see what the age group is. So if it's a kid, most common causes of epistaxis in kids, trauma. Second, Okay, hemorrhagic diastasis or hemorrhagic disorders. Okay, and trauma and also nasal pricking. And third, very important, should not forget, foreign body. Very good. So foreign body lodged inside nose for a long time. Many a times kids put some foreign bodies in their nose, they will not tell anyone. Okay, and it will get secondarily infected. Patient may. I have personally seen many patients like this, and quite a few in government hospitals will get patients like this. The old neglected foreign body came with epistaxis and also foul smelling discharge along with it. Okay, so the next point is, like I said, now come to the middle-aged group. For say a 40-45-year-old male patient has come to you. So what can be your differential diagnosis? He is saying that I am having recurrent episodes of epistaxis from either of the nostrils, either right or left or both, since last say 2-3 weeks. So what are the common causes in this age group? Hypertension. Okay, hypertension will always keep in mind because early onset hypertension is very common nowadays. Agekar dine, even when we were students also, we never used to utter hypertension in 40 years old. We'll above 60 hole আমরা hypertension বলতাম, but nowadays you can say, because hypertension is very common because of lifestyle changes. Hypertension is also very common in younger age group now. So hypertension. Okay, then see, trauma is always there. Keep trauma aside. Trauma is not a disease. It's just a situation. Okay, trauma ছেড়ে দিই, trauma বাদ দিয়ে বলছি। Chronic infections of the nose like chronic sinusitis can present with epistaxis. Okay, any tumor in the nose can present with epistaxis. Any pathology in the nasal cavities or the sinuses can present with epistaxis. Okay, I have already said hypertension. Now, if we go to the elderly age group, then the most important cause is hypertension. Okay, so how does the hypertensive bleed look like? How would you identify the bleed as a hypertensive bleed? What is the source of hypertensive bleed? Anterior. Little say the hypertensive bleed है? होते पारे, it's not like হয় না, but the commonest cause of hypertensive bleeding is venous bleeding. That's from the Woodruff Plexus, which is posteriorly located in the nasal cavity, in the sphenopalatine region. Okay, just behind the end of the inferior turbinate, where the Woodruff, the venous plexus is there. So that's a very common source of bleeding in elderly individuals who present with hypertension. Okay, so whatever, we will come to the site later on. We will discuss in details again. My point is, so with different age groups, your diagnosis or your differential diagnosis changes. Okay, kids, middle-aged, elderly, and elderly we can also suspect malignancy, chronic diseases, and also malignancy is very important. It can be malignancy of the nasal cavity, any of the sinuses, CA ethmoid, CA maxilla, anything can present with epistaxis. Okay. Next, age group we have already done. So now is, like I said, the onset and duration of bleeding. ঠিক আছে, আমি হিস্ট্রি ওয়াইজ পয়েন্টগুলো দিয়ে যাচ্ছি। তো onset and duration. So see, usually when a patient has a chronic disorder, usually they can never tell you the exact beginning of the episodes of epistaxis, because they are having it for quite a long time and they are having it recurrently. তো যদি প্রত্যেক 2-3 দিন ছাড়া একবার করে epistaxis হয়, তো 3 মাস বাদে কি মনে থাকবে না কবে এক্স্যাক্টলি শুরু হয়েছিল? It is practically not possible. So the patients usually give a rough idea around 2-3 months back it started, and every now and then I am having this epistaxis. Okay, or it can be acute onset like a trauma. The trauma holo, he knows exactly এই সময় হয়েছিল, we had that episode of bleeding and now it has stopped or it is ongoing, whatever the patient has come to you with. Okay. So insidious onset epistaxis are more suggestive of chronic diseases. Okay. And very important is progression. So if it is like many patients come to you and say, sir, 2-3 দিন বাদে বাদে হয় বা প্রত্যেক সপ্তাহে একবার দুবার করে হয়, বাট ওই একটুখানি হয় তারপর নিজে নিজে বন্ধ হয়ে যায়। It's a very common scenario. আর কিছু কিছু পেশেন্ট will come to you and say কে ওকে স্যার আগে অল্প অল্প হতো, যত দিন যাচ্ছে আরো বাড়ছে, আগে সপ্তাহে একবার করে হতো, এখন এভরি অল্টারনেট ডে আমার ব্লিডিং হচ্ছে। So that means there is some progression in the disease process. ঠিক আছে? So if a patient come to you with something that's off and on non-progressive, it is not gradually, there is no progression or no change in the nature of the presentation, then it usually suggests a chronic disease which is not progressive. Okay. One very common cause of epistaxis, particularly in middle-aged individuals or elderly individuals, is recurrent crustings inside the nose because of dryness or change in weather. Okay, so what happens is we all have a normal homeostasis, right? Every individual has a normal process of homeostasis, and what we do is when a person is particularly say in this hot temperature, if you are standing outside for a very long time, so we'll dry up, we'll have dehydration, we'll dry up, so there will be dryness of the nasal, decreased nasal secretions. Body will want to store as much fluid as possible. Okay, so the nasal secretions will go down, obviously, and you are breathing in the dry air. So this causes the mucosa to dry up and formation of crusts. Now these crusts, when they get dislodged, they can cause bleeding. একটা mucous membrane উপর একটা crust রয়েছে, সরে গেল, so there can be bleeding. This is a very very common cause of epistaxis, particularly in people who are exposed to hot weather or change in weather or extreme cold climates also. তো খুব ঠান্ডার দেশে দেখবি, ওই ঠান্ডার জায়গায় যদি যায়, it's very common, many people will have epistaxis because of this dryness. ঠিক আছে? তো usually very commonly এই যে পেশেন্টগুলো presents with recurrent episodes of epistaxis which are not progressive, almost একই রকম আছে বহুদিন ধরে, এইগুলো usually are chronic infections or this kind of recurrent crustings in the nose because they are exposed to a wide variety of they are exposed to a particular weather pattern or particular climate that they work in, so they may face this kind of problem. So it's also very common. Okay. And third, if it's a progressive disease, the patient has come to you and telling you ke ha age to majhe majhe hoto, ekhon khub beshi bede geche, prottekbar hocche, barbar kore hocche, so there has to be a pathology which is growing, তাই না? এমন একটা কিছু ডিজিজ রয়েছে যেটা বাড়ছে। ওকে, so it can be a benign lesion or it can be a malignant lesion which is growing, or it can also be a chronic infection which is progressive. For example, a chronic sinusitis, for example, it started with a ethmoid sinusitis, now it's a pan sinusitis. So the infection has increased too much. First, second হচ্ছে কি, it's a say malignancy, আগে একটা ছোট ডিজিজ ছিল, এখন there is more involvement, সাইজে বেড়েছে, আরো বেশি এপিস্ট্যাক্সিস হচ্ছে, আরো রিকারেন্টলি এপিস্ট্যাক্সিস হচ্ছে, or say a benign tumor, a simple angioma. Angioma, is a benign vascular tumor. It's very common in the nose, in the septum or over the turbinates. Or say a rhinosporidiosis. You've heard of rhinosporidiosis? Porchiston. It's an infection of the nose where there is a formation of colonies. So it can cause bleeds to touch. So there is a chronic infection which is growing. So anything like that. So these are the causes. So based on the presentation and the progression of the disease, we can also have differential diagnosis. Okay. So now the nature of how does the patient come to you? So they have either come to you with an active epistaxis or a history of epistaxis. ইদার তোকে এসে বলবে যে স্যার হচ্ছে, যেগুলো আমি বললাম এরকমভাবে বলবে, or they will directly come to you and tell you, or and you will see that the patient is having an active bleeding, which usually the patient presents at the emergency. In the middle of the night, you'll get a call that the patient is in the ER with severe nosebleeds or moderate nosebleeds or whatever. So, when the patient, so the management pattern or thinking is completely different when a patient is in active epistaxis. Why? See, if a patient comes to me with a history of trauma and active epistaxis, I will not panic. The patient had a trauma, it's taking time for the blood to clot. It's a normal patient with no history of any major bleeding diastasis or hemorrhagic disorders or something. So, likely the bleeding will be controlled easily, either by active intervention or by body's hemostatic mechanism. It will gradually be controlled. But if a patient has come to you with a severe epistaxis, and it's like, for example, you say a middle-aged male patient or elderly male patient, very commonly elderly male patients with severe epistaxis, and you don't know the background, it started suddenly. So then you are concerned because you don't know the diagnosis. You just know the patient is having epistaxis, that's it. But what is the cause of the epistaxis? You don't know. So, but primary objective is to control the bleeding, obviously. So, patient bleeding হচ্ছে, and you cannot go and ask যে কদিন ধরে হচ্ছে, কিভাবে হচ্ছে না হচ্ছে. You don't have that much of time because when epistaxis sometimes can be very severe. Patient can bleed loads, মানে একদম হুড় করে ছটছট করে রক্ত পড়ে. So bad. Okay. So, primary target is control of the epistaxis. Okay. Second is evaluation or identifying the cause of the epistaxis. ঠিক আছে? So, treatment of epistaxis has two main parts. First is control of epistaxis. Second is diagnosis of the root cause, diagnosis of the problem. So, when we are talking of control of the epistaxis, there are a few things that you should know. So, like the commonest site of epistaxis is little area that you have read already. Okay, so where is it located? কোথায়? Come on here. Little area কোথায়? মাথায়? Nasal septum কোন part? Anterior, inferior. Simple thing. It's anterior inferior part of the nasal septum. Okay. That is the commonest area of epistaxis. So a patient has come to you with active epistaxis. The first thing we do is, so we put pressure, packing point. First we give pressure, Hippocratic maneuver. So we just below the nasal bone, we apply pressure and persistently for 5 to 7 minutes or maybe more 10 minutes. Okay, what is the purpose? To stop the bleeding by pressure and let the blood clot. That's the first thing we do. Okay. So now after 4-5 minutes or 10 minutes you have pressed the nose and it's still bleeding. So next thing is nasal packing. We don't have any other option. Right? Remember, we are talking of severe epistaxis, not mild epistaxis or moderate epistaxis. I'll tell you. So we'll give nasal packing. So there are two types of nasal packs that we use. One is the anterior nasal packing, one is the posterior nasal packing, based on the site. And based on the material, we also have two different types of nasal packs. So what is anterior nasal packing? See, if we see the board name, board acha kana. So say এটা নাক বোঝা যাচ্ছে তো? So এটা columella তো lip. So this is the palate. So hard palate and soft palate. ঠিক আছে, and this is the skull base coming in. So say this is the এটা বাদ দে কলমেলা নয়, so this is the septum. ঠিক আছে, so our nasal orifice is this. Okay, and the nasal cavity is more horizontal than vertical. Nasal cavity কিন্তু এরকম নয়, nasal আমি বারবার বলি nasal cavity is parallel to the palate. যেটা আমি পলিপের দিন আগের দিন বোঝাচ্ছিলাম তোদের, ঠিক আছে, it is parallel to the palate. So whenever there is bleeding from the nose, if you put a pack like this area, will the pack go? No. Okay, so our target would be to put the pack parallel to the palate in layers. Okay, the commonest form of pack that we use, theoretically is used, is the gauze pack. So we have the ribbon gauze packs which we soak in antibiotic ointments so it doesn't get infected, because we'll need to keep the pack for some time for the bleeding to get controlled, maybe 1 or 2 days, usually at least 48 hours. Okay, so what we do is we take a long ribbon pack, we soak it with antibiotic ointment, use 2 instruments, don't forget this is asked in the exam. এবার আমি পরীক্ষায় জিজ্ঞেস করেছিলাম, একজন বলতে পেরেছে একজন পারেনি. 2 instruments, one is a nasal speculum which is a thudicum nasal speculum. So the instrument গুলো দেখেছিস কি তোরা? Have you seen the instruments? Not yet. Okay. Second is a teleforceps. It's called a thudicum nasal speculum. Thudicum nasal speculum. So what is the purpose? With the speculum we open the ears so that we can see inside. We can see the space inside. Okay. তারপরে we use the teleforceps, so it looks like this. It looks like this. So say this is the forceps and the prongs are like this. Okay, so it opens and closes like this. Okay. So with the teleforceps tip, we hold the tip of the pack. We put the first layer parallel to the palate, on the palate. Then we hold a little far and then again go ahead and pull the second layer and the third layer like this. Okay, based on the size of the nose or the size of your pack, you may put 2, 3, 4 or how much, whatever is required to give enough pressure, to create enough pressure inside the nasal cavity so that you can stop the bleeding by pressure. This is called anterior nasal packing. So here is a picture which is commonly given. Don't see this posterior thing. So this is the kind of thing that happens. বুঝতে পারছেন? This is the nose, this is the palate. We have gone parallel to the palate. হ্যাঁ, এটা পুরোটা প্যাকিংটা, এটা ফালতু, এটা কিছু না. So this is the pack. Their বাইরের এন্ডটা usually we either tie or we cut. So this is the procedure of anterior nasal packing. Don't forget these 2 instruments, thudicum nasal speculum and the teleforceps. আর এক সময় এক্সামের অনেক সময় জিজ্ঞেস করা যে what else will you need? You obviously will need a light source, a headlight or something, otherwise you cannot see what's going on, right? So এই দুটো তিনটে জিনিস important. Now tell me one thing, তার পেশেন্টের রাইট সাইড থেকে ব্লিডিং হচ্ছে, patient is having active epistaxis from the right nostril. So you will obviously pack the right side of the nose. What will you do to the left side? I want you to think. Why? Exactly. So your septum is cartilaginous. Middle part of the septum is cartilage. So it's more malleable, it's not bone. Right? But তুই একদিকে চেপে চেপে প্যাক দিয়েছিস. That means the septum is pushed to the other side. So now if you do not give pressure from the other side, How will you create the pressure on that particular segment, particular nasal cavity? You will not be able to. So you will have to put pack on the other side as well. Otherwise, you will not be able to create the pressure to stop the bleeding. Understood? ভুল হবে না তো এটা? So nasal packing for epistaxis or post surgery, we always do bilateral. Okay. Now what will you check? You have done the nasal packing. পেশেন্টের সামনে দিয়ে তো অবভিয়াসলি ব্লিডিং হচ্ছে না, সামনে দিয়ে প্যাকটা দিয়েছিস, কোথা দিয়ে ব্লিডিং হতে পারে? গলা দিয়ে, যদি বন্ধ না হয়ে থাকে। So what will you do? You will examine the oropharynx from the mouth. দেখবি যে if there is any active thickening or not. We usually wait for 2-3 minutes or 5 minutes at least, and then we use a tongue depressor to see the oropharynx. So that is another instrument that you will need for nasal packing. Tongue depressor দিয়ে টাংটা ডিপ্রেস করে আমি দেখব ফ্যারিংসে কোনো অ্যাক্টিভ ব্লিডিং আছে। So if there is no bleeding, that means you have controlled the bleeding. Now, প্যাক করেছিস, অ্যান্টিরিয়র প্যাক করেছিস, টাং ডিপ্রেস দেখছিস ব্লিডিং তাও এসে যাচ্ছে। Patient is still having bleeding after you have given a nasal pack. What is your next step? Here comes the role of posterior nasal pack. So most likely the patient is having a posterior epistaxis from area like this, which I said is usually a venous bleeding. It's from the Woodruff's Plexus. It's a posterior epistaxis. এখান থেকে ব্লিডিং হচ্ছে, তুই যতই অ্যান্টিরিয়র প্যাক দিয়েছিস তাও there is not enough pressure on that area so that it can stop the bleeding. So here comes the role of posterior nasal packing. So posterior nasal packing is something that is done in case of intractable epistaxis. It is very painful for the patient. So we try to avoid posterior packing as much as possible. Okay, unless it is absolutely required, we try to avoid. Okay, but যখন severe হয়, it's not getting controlled, sometimes we'll have to do it. So either we can use something like a gauze pack. So what we do is how will I explain? So we take a catheter or something, we put it through the palate and take it out from the mouth. We tie the pack here and then gradually pull it out. Okay. So if you need a posterior pack, you will first have to remove the anterior pack, then put the posterior pack, and then do the anterior pack again. So how will you see posterior? See, this is the palate, right? This is your nasopharynx. So you're putting the pack over here. This pack will not come to the nasal cavity. Posterior pack has to be big enough so that it doesn't come to the nasal cavity. Because পেছন থেকেও প্রেসার দিতে হবে, সামনে থেকেও প্রেসার দিতে হবে। Otherwise you will not be able to stop. কারণ পেছন থেকে প্রেসার দিলে ব্লিডিংটা সামনে দিকে থাকবে। বুঝতে পেরেছিস? So posterior pack cannot be there without anterior pack. Anterior pack you can give alone, but whenever you are giving posterior pack, you have to have anterior pack. Okay, another way of doing is we sometimes use a Foley catheter. You understand Bengali? Okay. ধর আমি posterior pack দিয়েছি, posterior pack দিলাম মানে so it snugly fits between your nasopharynx and the palate, nasopharyngeal wall and the palate, এখানে লেগে আছে, তো তোর এখান থেকে যে ব্লিডিংটা হচ্ছে it will still come out of the nose, the patient will still continue to have epistaxis. So if you are putting a posterior pack, you have to have an anterior pack to create the pressure to stop the bleeding. এবার তোর শুধু সামনে থেকে হচ্ছে, সেখানে তুই শুধু সামনের প্যাক দিলেই বন্ধ হয়ে গেল। Posterior bleeding is usually from such a location যেখানে posterior প্যাকটাও পুরো পৌঁছয় না, anterior প্যাকটাও পুরো প্রেশার দেয় না। So when you are giving a posterior pack, you need to have the anterior pack. But anterior pack you can give separately. Only anterior pack you can give. Okay. So sometimes we use another thing which is called a Foley catheter. What we do is we put the Foley catheter through the nose, take it out of the mouth, then inflate the Foley catheter with air. not water. Remember this thing. I'll tell you why. হাওয়া ভরবো ফলিক ক্যাথেটারটা, we will, the ফলিক ক্যাথেটারটা এরকম ছিল, তো we will dilate the balloon, তারপরে ফলিক ক্যাথেটার আস্তে আস্তে রাখ দিয়ে টানবো, so it will go in through this and will snugly fit here, so that replaces a posterior gauge pack. Gauge pack যদি আমার available না থাকে, বা sometimes gauge pack is very painful to put in, then we use this Foley catheter. It's a substitute for a gauge pack. So this is just an added information. পরীক্ষায় যদি জিজ্ঞেস করে বলবি, না হলে ডিরেক্টলি বলা দরকার নেই। Always say posterior gauge pack. That is a standard procedure. ঠিক আছে? So why do we use air, not water? Patient শুয়ে আছে, already had a bad episode of epistaxis, so somehow traumatized. তো সিডেটেড আছে ধর, তুই জল দিয়ে ভরেছিস ফলিক ক্যাথেটারটা, by any means if it ruptures, the patient will aspirate. তাই তো, it's in the nasopharynx, বাল্বটা ফেটে গেল কোনো কারণে, maybe for movement of the patient, বা any reason, valve can rupture. If it ruptures, all the water will go into the trachea or in the air, because the patient may not be conscious, may not be ambulatory. Conscious থাকলে ভালো, he will swallow or he will spit out or cough out, whatever. But if by chance he is not conscious or is sedated or something, he may aspirate. So always use air, not water. Okay, for posterior nasal packing. ঠিক আছে? So another thing is, what are the materials that we use for nasal packing? Commonly used materials, like I said, is a ribbon gauge pack. Because ribbon gauge pack is a standard in active epistaxis, it can give the maximum pressure. সবচেয়ে বেশি pressure, because you can apply the pressure yourself. কতটা pressure দিচ্ছিস, you can decide how much gauze you are putting in, how much of the pack you are putting in. That can tell you how much pressure you are giving. Right? এবার যদি ধর তোর কাছে রিবন গজ নেই, অথবা the epistaxis is not as severe, একটু একটু করে হচ্ছে, বন্ধ হয়ে যাচ্ছে, it's not that bad, then we can use something like a synthetic pack, যেটা হচ্ছে we call it a merosil nasal pack. কোথায় গেল এটা? It's called a merosil. It's a self-inflating pack. So what we do is, it is like a thick, if I could show you, it would have been fine. It looks like this, a thin, solid kind of thing that easily goes inside the nose. Whenever it absorbs water, it swells up. It is sometimes coated with hemostatic materials. So when it swells up, it puts pressure all around. So it works the same as the nasal pack, but obviously the pressure is less and depends on the size of the merosil that we are using. Normally we have two common sizes, a 7 cm, 10 cm. 7 cm we usually use for females and kids, and 10 cm for adult males. Okay. So this was the management of severe epistaxis, controlling the epistaxis. So normally we keep if it is antibiotic soak, we keep the pack for at least 48 hours, and then we remove the nasal pack, because we expect by 48 hours it will gradually, there will be clotting and the bleeding will stop. Okay. So during removal of the nasal pack, we always use a liquid hydration. We make the pack hydrated. We repeatedly put water around the pack to make it soft and remove all, because by these 2 days there will be a lot of drying up of the mucus around, so the pack will get stuck. So আমরা একটু একটু করে বার করব, and we put water and gradually make it moist. একটু করে will gradually, so there is no pressure, because we don't want to dislodge the clots. Okay, that if there is an epistaxis, there has to be some breach of mucosa, obviously. কারণ mucosal breach তো হয়েছে, তবেই তো ব্লিডিংটা হয়েছে। তো দুদিনে তো don't expect the mucosa পুরো হিল করে যাবে। So bleeding is not by clots only. So if you remove the clots, it will bleed again. But you cannot usually keep the nasal pack for more than 48 hours, because it can cause infection. Okay, because then the secretions will get collected. The same pack, a ribbon gauze kept inside the nose, it will act as a foreign body and will gradually invite infection. So If you need to keep the pack for a longer period of time, you may have to remove it and put a fresh pack. Okay. But most of the times, usually by 2 days, the bleeding stops. This Merosil pack, usually we can keep a little longer. 4 to 5 days we can still keep it if absolutely required. Okay. So now after the pack korechish, bleeding bondo hoye geche. So now you have removed the pack, but you still don't know what is the cause or what was the cause of the epistaxis. So what are the vital things that you should check? Obviously blood pressure. So whenever you are putting the pack in, you also check the vitals of the patients obviously. When the patient has come to you, you see the blood pressure, the pulse rate, or any other known comorbidities like a history of, say, many patients, elderly patients come to you with history of taking cardiac medications, antiplatelets, which can cause bleeding, very common. So very commonly this happens because I work in a hospital where there is a very good cardiac department. So when we have patients referred from the cardiac side, they often ask, "Is sir, হার্টের ওষুধ বন্ধ করলে ব্লিডিং হচ্ছে নাক দিয়ে, আর নাকের জন্য যদি আমি এই হার্টের ওষুধ চললে নাক দিয়ে ব্লিডিং হচ্ছে, আবার নাকের ব্লিডিং বন্ধ করতে গেলে যদি হার্টের ওষুধ বন্ধ করি হার্টের ক্ষতি হবে, তো what should we do?" So in these scenarios, you have to discuss with the cardiologist about decrease in the antiplatelets, how much you can decrease to have a safe cardiac, have a safe environment from the cardiac side, and also make sure that the patient doesn't have too much of epistaxis. Many a times it is not possible because the patient may have a history of recent cardiac procedure, okay, or anything like that. In those cases, you may have to explain to the patients, okay, you have to be put on antiplatelets because epistaxis can still be managed by packing, but if you have a AMI, it is difficult to manage. Okay, so these scenarios can arise. So these are all practical scenarios that you will gradually face when you work. There you go. Epistaxis, the next thing is direct control of bleeding. So your patient has come to you with mild to moderate epistaxis. আমি চলে যাবো একটু পরে। হ্যাঁ ডেন্স আর ডেন্স একটু পরে আসতে। So another thing is direct control of epistaxis. So patient has come to you with a mild or moderate epistaxis off and on, not actively bleeding, or maybe actively bleeding but very less. Okay, then we usually think of either we can put a pack, wait and do a second stage procedure, or sometimes if you have adequate setup, we prefer to go for a direct nasal endoscopy and control the bleeding directly and cauterize the site of the bleeding directly. So like I said, the most common area is the little's area. So if you're seeing an active bleeding from there or anywhere else in the nasal cavity, you can directly cauterize that area using a bipolar forceps, nasal bipolar forceps. You can cauterize that area. Okay. So another, what is the most important blood supply of the nose? Anterior. Anterior is a branch of which artery? Direct branch. Okay. And what are the other posterior girdle? Posterior girdle is a branch of. That you said, na? Why are you telling sphenoparietal artery? So this is the sphenoparietal artery, gives a septal branch. Okay, which is also a very common cause of bleeding. So we also have procedures like endoscopic sphenoparietal artery ligation. We call it ESPAL. Okay, sometimes we have to do it for intractable epistaxis, where even with packs, whenever you are removing the pack, the patient is having bleeding. You take the patient for endoscopy, try to cauterize that area, you still are unable to. Whenever you are cauterizing, it may be stopping for a few minutes and they can be bleeding. So then you will have to go straight ahead and ligate the vessel. The problem with nose is, nose is a confluence of both internal and external carotid vessels. The ethmoidal arteries are from internal carotid vessels. The sphenoparietal artery is a bunch of maxillary artery. Maxillary artery is a bunch of external carotid artery. So it's a external carotid system. So both the systems are involved, right? You can never ligate the internal carotid artery. The patient may have a CVA, right? So the difficult area is if you can diagnose that there is a posterior bleed from the sphenopalatine artery region. Sphenopalatine artery usually opens at the end of near the posterior end of the inferior turbinate. So that's the area. It runs behind the maxillary sinus. Okay, and comes out through the sphenopalatine foramen. So now, if the nose is like this, say, so there is a maxillary sinus on each side. Okay, the sphenopalatine artery comes from laterally behind the maxillary sinus and opens here. It is anterior, or it is posterior. The sphenopalatine artery runs behind the posterior wall of maxilla and comes out and opens in the nasal cavity. It gives a septal branch which goes over the choana and comes to the septum. Okay, so এই এরিয়াতে যদি তোর if you see a bleeding from there, or if you are suspecting any bleeding from there, or there is a nasal mass which is directly fed by this tumor, you can identify. Then you can go ahead and ligate this vessel endoscopically. Sometimes so the procedure is complex. It's very difficult to explain right now because you don't know the instruments and everything. So we open the maxilla, remove the posterior wall of the maxilla, and then go ahead and do it. Or sometimes we directly cauterize the opening of the branches of the. Because we just go near the posterior wall, we remove, lift up the mucosa and identify the branches of the sphenopalatine artery and cauterize it. So these things are not important. Just remember the name: endoscopy, sphenopalatine artery ligation. Sometimes we need to do it. Okay. Before ending, I mean, epistaxis, there are a lot more. I will from the next class also we'll discuss about epistaxis because we need to go through the specific diseases. Those are important for your exams, like angiofibroma. We have not discussed about JNA. I've intentionally kept the topic out because it needs time. There's a lot of things considering. So JNA পড়িয়েছে কয়জনের পড়িয়েছিল না? Dr. Faijanul took the class on JNA, right? অন্য ব্যাচে নিচ্ছে থিওরি ক্লাস হয়েছে হ্যাঁ জানি বাট থিওরি তো জেএনএ হয়নি থিওরি সো নেক্সট ডে উইল ডু জেএনএ ইটস a very interesting topic. Next week I don't know whether I mean just করতে পারবো কিনা because of this vote and all তোরা থাকবি না আমি আসতে পারবো কিনা I don't know, but next week we'll definitely have. I'll try to do it next week if you all there, but I cannot commit to be honest. আমিও জানি না কি পরিবেশ পরিস্থিতি থাকবে তারপরে because of voter results, so all these things are going on right now a bit here and there. Let's see what happens. We'll manage something. If that day doesn't happen, we'll take some other day. We'll inform the CR, we'll arrange something like that. Okay? But JNA needs a separate class. There are a lot of things because long questions come from JNA. You may have long questions, you may have multiple viva questions from JNA. JNA is very important.